The fourth abstract will be presented by two people. Without taking much time, this is for you and you can present your paper. Kavihari and Kalara Perera.
Good afternoon, everyone. I'm Kalara Perera, and this is my friend Ravendra Kumar. So this is our topic. To briefly introduce why we selected this topic, it's because nowadays we see a lot of young people using digital platforms to sort of get information as like a source of information. And what we realize is that unlike very traditional settings, like if you're getting information from maybe your parents or your school or whatever other programs, they stick to very specific subject areas. So sometimes sexual and reproductive health does not necessarily limit itself to childbirth or menstruation. It's something much more. So in that sense, things like exploring your sexual orientation or sexual pleasure, things like that, young people usually tend to look through it through social media. And in that sense, these social media influencers have found their role in that platform where they are able to sort of provide the answers in a very relatable manner. And they are also, when they try to give up this message, they are also having this sort of barriers, these cultural barriers, and also these other limitations, but they are also engaging and trying to sort of engage in this discourse on sexual and reproductive health. This comes to our objective, which is basically the study aims to explore how social media influencers create content focusing on sexual and reproductive health as a means of engaging social media users in the broad discourse on SRH with emphasis on the South Asian context is what we are looking at. So the methodology, this is a sociological research. It's completely based on qualitative data. We did a manual content analysis. What we did was we basically went through our literature and we came up with a couple of keywords, and we used those keywords and manually entered it on the specific social media platform that we selected, which was Instagram. So we selected Instagram because a lot of young people tend to use Instagram, and from Instagram we manually entered the keywords and we got a list of people, and from those people that we selected, we connected with other people on the same list, and we came up with like a pool of 10 people. And of course, this is a purposive sampling, and through and also the influencers that we selected, we made sure that they are from like from South Asia. But unfortunately, most of the influencers that we found were from India or Indians living outside of India. So, and with this is our literature review. So for literature, what we figured out was the fact that there is literature on social media influencers, how their expertise on commercializing a sort of product, but not so much on how much effective they have been on raising awareness on like a public health policy sort of avenue. And most of it was not in the South Asian contents. Actually, we couldn't find anything related to South Asia and how social media influencers are raising influence on that. So with this, I'll hand it over to my colleague Ravihari.
So basically, I will go through our results, the results of our study. One of the things that we noticed was that incorporating multidimensional narratives is very important, but it's crucial to understand that engagement doesn't always mean that there is effective information dissemination also, especially when it comes to sensitive topics with regards to sexual and reproductive health. For instance, one of the interesting things we noticed was that there was a variety in technique, especially there's a lot of humorous skits, etc., that are used to disseminate this information. But one of the things that we noticed was that such content can be reliable in some instances, but could also risk trivializing certain serious issues. It should be handled rather delicately. So while variety is important to ensure that content remains accurate, respectful, and educational, it is important to draw a boundary with regards to information dissemination via social media. Another thing we noticed was expertise caution. Most medical professionals, we noticed, who were SMIs, discuss certain subjects in order to sidestep legal or ethical complications. So basically, they don't give medical advice on Instagram. Although influencers still offer, however, valuable and insightful conversations about their personal experiences or promoting expert resources, etc., rather than positioning themselves as authorities. That's something we noticed. And we also noticed that intersectionality and the lack thereof that leads to a homogeneity of subject matter in the content that is created is important to note, especially youth, individuals from the LGBTQIA plus communities, and those from certain socioeconomic backgrounds often face unique SRH challenges as opposed to other communities. And by failing to address these specific issues, influencers may inadvertently alienate these groups and provide information that focus on a homogeneous group of people as opposed to looking at more diverse groups of individuals. The other thing we noticed was that influencers might tailor their content to what they believe is a potential group of individuals to whom their content is created, but that might also lead to them avoiding controversial topics, and because of the fear of backlash, etc., they might not talk about more important things. Another thing we noticed was that there was a very rigid medical versus non-medical binary. So medical health professionals on Instagram creating awareness on very traditional and conventional topics, and then there are non-medical influencers, so to speak, who talk about more non-traditional conversations such as sexual pleasure, sexuality, sexual orientation, etc. So that's something we noticed, and we thought that bridging that gap is very important. And content creators and audiences and the audience engagement was something we also looked at, which largely remained within the gendered framework. So we noticed, and I don't want to make generalizations, but largely men tend to respond to certain topics like sexuality and sexual pleasure a little bit negatively than women audiences. That's something we noticed. And women, on the other hand, they thought that some of the content was very empowering and that it talked about establishing a safe space for women to talk about their sexuality and talk about the concerns that they have in safe spaces. So that's something we noticed. So our conclusion is basically that social media influencers play a huge role in destigmatizing female sexuality and talking about certain topics. But however, we notice that certain topics are largely still left undiscussed, and that's something that needs to be addressed. One of the limitations of our study was that even though it says South Asian, we are looking at the South Asian demography, we couldn't actually look at it because there are no Sri Lankan influencers as such, or Bangladeshi influencers or Pakistani influencers that we could find with a big outreach who talk exclusively about sexual and reproductive health. So these are our recommendations basically. So advocating policy initiatives and encouraging individuals from other geographical regions and within the geographical region from other countries to talk about their concerns and to talk about sexual and reproductive health, and to engage with influencers from different backgrounds, gender identities, to enhance representation and inclusivity, etc. And we've also mentioned that incorporating evidence-based resources is very important. So we noticed that some of the social media influencers also collaborate with medical experts, which is also very useful. And it has to be a very interesting and nice collaboration between medical and social and people from basically various professions and various backgrounds, especially professional backgrounds. It could be different socioeconomic backgrounds who talk about these things openly and engage in conversations that include everybody as opposed to certain people only. So that's something that we would like to conclude on. Thank you very much.